The chance of being diagnosed with thyroid cancer has risen in recent years. In fact, it is the most rapidly increasing cancer in the U.S. Because most thyroid cancer is successfully treated, many people who are living with thyroid cancer are often told it's a good cancer. That belief is actually a myth. The truth is, thyroid cancer, like all cancers, can have a significant impact on a person's life, and calling any cancer good dismisses the life-changing realities of the disease. Joining me today are Dr. Marcia Brose, Associate Professor of Otorhinolaryngology, and thyroid cancer survivor Victoria Ballesteros, who will share with us the truth about living with thyroid cancer and how you can show your support for those living with the disease. Hello, Dr. Brose and Victoria.
Hi,
Hello.
good morning.
Now, first, Dr. Brose, why is thyroid cancer often referred to as the good cancer?
Well, I think it's a terrible name, don't you? So
Yes.
thyroid cancer is referred to as a good cancer because the vast majority of our patients will be successfully treated. However, the truth of the matter is that even if they're successfully treated, they will live with the impact of that disease for the rest of their lives. There'll be medical issues as well as psychosocial issues that will affect their quality of life forever. So that's one of the myths we're hoping to dispel as part of this campaign. Thyroid cancer is not a good cancer, and these patients really need proper medical care as well as supportive care.
Yes, absolutely. Now, Victoria, what are some of the physical and emotional challenges of living with thyroid cancer?
So for me, the effects were immediate. I had severe complications after my surgery, and then 5 years later, I'm still dealing with some of the effects, the long-term daily effects, including having to take medication every day for the rest of my life. I struggle with my energy levels. I get fatigued fairly easily. I struggle with maintaining my body temperature. My weight fluctuates. I have trouble sleeping at night. And then, of course, there's also the emotional effects, including the anxiety that comes with having to have blood work every 3 months just to make sure that everything's okay and that the cancer hasn't come back.
Wow. And also, Victoria, what is the truth about TC Challenge? Can you tell us a little bit more about that?
Yes, we are so excited to be launching this campaign. It's a partnership between 3 organizations: THYCA, the Thyroid Cancer Survivors Association, the Light of Life Foundation, and AZI. And so it's a social media campaign. It's a social media challenge to really dispel this myth that somehow thyroid cancer is a good cancer. So we're asking everyone to please support this cause by posting on their favorite social media, using the hashtag #TruthAboutTC. And for every person who, you can post a photo, you can tag your friends. For every person who uses that hashtag #TruthAboutTC, AZI will donate $1 up to $50,000 to support these 2 very important nonprofit organizations that provide services and support to thyroid cancer patients like myself.
Sounds like a wonderful initiative. Now, doctor, is all thyroid cancer the same?
Actually, they're not all the same, and as it turns out, it matters a lot which subtype of thyroid cancer you have. So one of the first things a patient needs to find out from their doctor is what subtype do they have, and then based on that, both the therapies as well as the prognosis for these patients will differ greatly. So it's a very important and key piece of information they need to know.
Absolutely. And lastly, can you both share with us where can people go for more information on thyroid cancer as well as the Truth About TC Challenge?
Absolutely. So if people want information on services and supports in their local area, they can visit thyca.org. They can also visit lightoflifefoundation.org for information and resources in their community as well.
Great, thank you. And just like they said, to learn more about thyroid cancer and how to support the Myths and Truths About Thyroid Cancer initiative, visit www.thyca, that's THYCA.org, or lightoflifefoundation.org. Thank you so much, Dr. and Victoria. It's been a pleasure.
Thank
you for having us.
Have a wonderful day.
Thanks.